I've also seen in the news that there is a shortage of beds in our hospitals. Does South Africa have the resources to be able to fully deal with such a pandemic?
So that's an interesting question, and I was attended a presentation last night where they went through all the bed allocations in the country, and overall, if we look at the country in total, there are enough beds available to provide for those who are actually getting infected with the virus currently, the way the epidemic is at the moment. But that's taking the country as a whole. So you may go to a specific region, and that region there is a shortage of beds because in another province there's extra capacity. So we may be reaching a point of getting quite close to our bed capacities in specific regions, but overall nationally there is availability of beds, and I presume the authorities, if we needed to move people to get them into hospital to be treated, they would be able to. So currently we are not at the point that we've run out of beds, but obviously that depends how the infection spreads, and I'm sure that relieves a lot of people, that there is space. And certainly then we'll look at the ICUs, and currently it looks like that in the ICU space, if the pandemic carries on like it is, we will have enough space in our ICUs around the country to treat everybody. However, as we know that this virus is changing daily, and should the numbers and our infection numbers increase and people not take responsible action to protect themselves, those numbers could get out of control, and then perhaps we could have a shortage of both a number of beds and space in our ICUs.
And now, Doc, I've also heard that a lot of day-to-day things, such as drinking warm water with lemon, gargling with apple cider vinegar, can actually help flush the virus out of your system. Is this true?
So I haven't seen any scientific evidence to that any homeopathic or herbal or home remedies actually either prevent getting the virus or actually kill the virus. What we do know is that if you get infected with a certain amount of viral load, you will get infected. However, having said that, if they're infected, everyone should do it's a symptomatic treatment. So if drinking tea or taking some herbal remedies makes you feel better, then you should do it. What I do know is that if you get infected, let's just take a step back. Everyone through this process and through this pandemic should have a good nutritional program and should take multivitamins if they can. So vitamins and multivitamins are actually an essential way, particularly vitamin D. But if you can take a complex multivitamin, that would be fine. Should make sure that their nutritional intake is good and they have a good vitamin balance. Once you've been infected with the virus, the only way to really treat it symptomatically from a medical standpoint, until you get admitted into a hospital, that's when your symptoms become quite severe, is actually by paracetamol. So it's just symptomatic support if you're feeling unwell, and a vitamin complex. But then to answer your question, if whatever your herbal remedies, etc., that make you feel better, then just like any other cold or flu, then you can add that into your regime as well.
And what about steaming? Can that kill the virus?
Yeah, so steaming, I saw that there were people steaming their nose because the view of that it kills the virus. I don't think there's any scientific notes to prove that at all. Steaming, once again, that's symptomatic. If you're feeling congested, just like if you have an asthmatic or if you have allergies, then you would use steaming, and that would actually help you. But it doesn't. It's symptomatic help. Helps your symptoms. It doesn't help in terms of killing the virus. And I think that's important for people to understand. Whatever you do, you're going to be treating the symptoms. We're not at a point. We're so early on in this epidemic and pandemic that we're not at a point that we actually have effective treatments for the virus.
Okay.
To cure the virus, I should say.
Now, let's discuss Artemisia. So this is something that has been trending in the country for the last couple of weeks. And a lot of people seem to have jumped onto the bandwagon, and they're drinking the herb. Do you think that Artemisia can help prevent or treat COVID-19?
Yeah, I mean, I know that there's been a lot of literature written on that, and I've done some research on that. I can't find any studies or to show that it has any additional effect in terms of treating the virus. Because I'm a doctor and I'm a scientist, I'd have to see studies on that to show the effects and that it actually has a proven result. And I think that's where we are with the moment. We do know Artemisia. We know a couple of other remedies that have been pushed around the world, but there's been no evidence to date to say that they actually have any additional effect in terms of treating the virus. Okay. So in summary, and I think it's important for our listeners to know, in the mild and symptomatic setting, there's no definitive treatment at the virus. That's why I've said anything symptomatic that helps relieve your symptoms is the correct way. Once you get into a hospital and you've developed respiratory symptoms, there are definitely treatments that are actually showing, right as we speak, they're showing an effect in terms of decreasing the disease and the death rates. And we do know, for example, dexamethasone, which is one of the treatments, it's a steroid treatment, and it's not, you can't go buy this in your pharmacy. It's given intravenously, that's into your blood system. If you get admitted into a hospital, it significantly decreases the death rate currently. And I think the latest studies are showing around about a 20 to 30% decrease in mortality. That's getting the disease and your death rates. And that's one of a few medications that are being used in hospitals and ICUs. But once again, those treatments actually treat the symptoms of the virus. They don't cure the virus. Currently, we don't have a cure in terms of treating COVID-19.
What sort of medication would you prescribe someone that is self-medicating at home?
So I would make it quite simple. I would say take things for the symptoms. So particularly, as I said, paracetamol, Panado, just, your temperature, feeling a bit unwell, definitely multivitamins, complex multivitamin, vitamin D. And then if you've got specific but these you need to speak to your specific doctor about. If you've got nausea, diarrhea, etc., there are specific symptomatic treatments that you could take. Once you get into hospital, there are other treatments, but that obviously would be given by the specific physicians if you get admitted into hospital.